All right. Thank you for joining us today, Mr. Spence. Before we get started, do you mind giving us an overview of your role and the systems you're responsible for securing?
Yeah, absolutely. My name's Charles Spence. I'm the Senior VP of Technology at Managed Healthcare Associates, where I have oversight over not just their technology, but also cybersecurity functions. MHA is the largest alternative site GPO in the healthcare services space, and we also have a lot of digital products and services for that community as well. So excited to be here.
Okay. Thank you. All right. So you've led technology strategy inside large healthcare organizations while also advising startups and AI companies. From your perspective, what makes cybersecurity in healthcare uniquely difficult compared to other industries?
Yeah, I think, healthcare sits at a unique and interesting intersection of a few things that very rarely do you see them converge together outside of maybe like Defense Department, um, where really life and death stakes are at play, right? This is one, sensitive data, PHI, PII, that types of things, and infrastructure in the entire ecosystem of healthcare, that not all of it was designed with a security first mindset when those products and services were coming to market. They're usually crafted either in response to that or having to be amended. So that's the sort of the interesting aspect, around what makes healthcare unique. For example, if you look at financial services, a breach costs money, right? Money can be replaced. In
Mhm.
healthcare, a cyber attack, a breach, not only causes revenue delays, but it impacts surgeries, procedures can cause life or death situations to manifest themselves. And it's something that impacts all of us, right? Because we all consume the healthcare services in one way or the other. It's just a matter of time, right?
Yeah. So one of those aspects that converge in healthcare would be those legacy systems that
Mhm.
attackers can exploit, older medical technologies, things of that nature. So how big of a security challenge do you see that today? And do you realistically see the industry modernizing fast enough?
Yeah, that's a great question. Yeah, I think this goes back to also the uniqueness of healthcare. And healthcare is such a broad domain, right? You got everything from delivery systems, physician groups, to insurance, to payers, PBMs, healthcare information technology vendors, to medical manufacturing device companies, supply chain, et cetera. The challenge with when you look at a broad brush across all of those things, you have a very fragmented environment with different types of technology at different states. You can go into a hospital in a rural setting where you find a nursing station on the legacy version of Windows as a core operating system. Firmware in an infusion pump could be running a outdated firmware set, legacy ERP, legacy EHRs, all those things not maintained and managed. And the underlying infrastructure supporting all those things really sort of goes to a broader theme of in healthcare, there is a structural a legacy problem that is tied to all those systems I've said, but also the processes and technology that sort of govern and tie those things together. Um, so I think, short answer is yes, there is a challenge and a problem. Do people realize it? I think they do. There's a lot of activity. Federal government has a lot of working groups taking flight. Commercial industries has working groups in flight to standardize and address and tackle those things. And a lot of organizations are putting that into their budget. But I think one of the challenges is having it where people don't see this as a technology refresh activity, right? It's like this isn't as simple as changing out a laptop because it's 3 or 4 years old. This is really a risk reduction program to try to address those structural deficits that impact your ability to provide and manage care to those members in our community, right? So that's the biggest challenge is, how do you do that? How do you prioritize that? Because there's limited capital. You can't do it all at once. So there's a lot of interesting dynamics in there, but there's definitely a challenge when you look at the broad scale of healthcare in general that has to be addressed.
Yeah, so as far as prioritizing those investments, are there certain systems that healthcare organizations should focus on first, as opposed to systems they should modernize later? What's kind of a way they could go about making those strategic decisions?
Yeah, absolutely. When you look at investing where you're going to spend your money when it comes to security projects in particular, right? It's always a risk to reward ratio, right? Because there's always going to be vulnerabilities, exploits, or challenges. So what do you do and have to go after it? And this is where the concept of defense in depth and value to cost sort of come into play. So as a technology and cyber leader, what you should be doing, working with your business partners, your CFO, CEO, COO, CMO, whoever it is in your respective domain, to understand what are the biggest risks you have that have a tangible impact to your ability to fulfill and execute on your mission. So if you're a delivery system and you're taking your number one business and mission is taking care of people, well, what does that mean? So start focusing on those systems that directly orchestrate those activities, and then start walking it back to other things that are maybe important, but they're not as critical or as impactful, aka causing someone to die because of wrong medication being prescribed, wrong surgery because of wrong clinical documentations or care plans were being recommended, right? So a lot of those things sort of go into the mix, but it should always be based on and grounded on, well, not just because it's a risk and has a high vulnerability score, but what's the actual impact based off your environment and the actual impact to your business.
Yeah, so for organizations that can't modernize, what are some other strategies they can use to protect their systems when modernization isn't in the budget or it's just for some reason not an option for them?
Yeah. So the good thing is today, in particular, with very little cost and using some of the AI tools, the first thing I would do is using some of these tools to do a full capability scans and vulnerability exploits in their environment. Tying it to their different systems and logs, just so they get what I call a 360 landscape of their actual footprint and what those risks are. Those AI tools can help them sort of figure out stopgap solutions to sort of get in place some controls to minimize and mitigate some of the risk. The other piece that I would always recommend is if you had dollars to spend, focus it on your infrastructure that is the firewall between you and the external world. So stuff between your firewall, identity access management, MFA, those type things. Focus on those things first if you have to, and then use some of these other tools to aggregate and improve on some of your maturity of your discipline. Because even if you got a process, and as long as that process is well defined and followed and regulated, you may not be on the best of breed of solutions, but you have a process in place and you're still making it a barrier for others to walk easily into your environment and run wild, right? So if you can at least have some type of discipline and some type of measured approach, then you can at least be a deterrent for somebody looking for an easy target, right? And that's really what you're trying to do is like, what protections can you do with what you have to give you the best chance of having least impact to your business operations.
Right. So, speaking of those AI tools, right now there's a lot of excitement around AI improving efficiency in healthcare and in other industries, but it also expands the attack surface significantly. So, where do you think healthcare organizations are moving too quickly with AI right now without fully understanding the operational or the security risk?
Yeah. You can't go a week without a new AI capability or tool coming to market, right? And this is probably, I haven't seen anything like this where before, a lot of the new technologies and tools were really made available, but in the hand of a small group of people, right? Technologists in terms of these things, right? But now it's a tool and force multiplier for anybody. You don't have to have a tech background. You have a good idea, you could do things, right? So, and there's so many good ideas to do, and healthcare is right for modernization in general. So it's a very target-rich environment, so to speak. The biggest, I think for me, the biggest underestimated risk is really around data provenance and data availability. All these AI tools are great, but they require data, right?
Mhm.
Either data you have, data you have to source, data you have to integrate into. But not all that data is stuff that you own, but it's going to be tied to a key process. So questions around, okay, what are your contractual protections? What are your data use rights and data access rights? So, when AI first came to healthcare, it moved very fast with clinical data documentation. AI assisted coding, predictive analytics, like we're seeing now. But in many cases, the general data governance of all of that stuff is not keeping pace, right? Because if you look at just some of the recent news and articles where you're finding a lot of the supply chain attack vectors, that are going after that AI supply chain of data, right? And they know if they can get in there and inform in some of those data flows, they have an opportunity to cause interference and really have an impact, right? And then you as an organization got to deal with the data breach rights and notification, exposure, et cetera. And a good example of this is where you're talking about, some of the concerns. The world of AI, prompts are king, right?
Right.
So when we start talking about prompts, one of the biggest security nightmares for any technologists or security engineers, prompt injections, right? Where somebody is trying to compromise your environment by injecting into prompts to manipulate your data models, right? So templates and Word documents with prompts hidden in the background. So when you upload a document just for a cursory read or outbreak, next thing you know, it's running some type of attack on your system or your enterprise, right? So I think that's really the thing. It's like the data provenance, but also thinking through, what are the broader risks that are associated with that? Because data is now so proliferated that any of those data sources becomes a new attack vector, right? But on scale, right?
So what are some things that healthcare organizations can do to secure their data from, risk posed by AI, especially sensitive data like patient data, which obviously, you can't have leaked to AI sources.
Yeah, so I think the concept of data minimization really goes into play for all of stuff, right? A lot of the stuff we talk about is, hey, especially with AI, it's the more data you give it, the more granular, prescriptive, and insightful or impactful.
Right.
However, double-edged sword, the more data you give it, especially if it's outside your firewalls, right? It's a open source or it's a cloud-hosted data model, right? Where you're using some of these LLMs or whatever, you just opened yourself up. So in a lot of these cases, specific use cases where it may be a clinical workflow or some type of operational process that has sensitive data, right? You really want to probably arm it with the least amount of data to enable or make that workflow effective, right? Or use de-identified or synthetic data where appropriate. But beyond that, a few things that organizations can do. Contractual data rights. As you look at our ecosystem and you're onboarding and working with all these companies, every company now is now an AI a company, right? Most of them have changed their same product. They just changed their website to .ai, or they've added some type of chat GPT capability.
Added some sort of agent or
exactly.
assistant or something.
Now I'm AI, right? But so it's good. They're trying to embrace it and help you get better by their products and offerings. But that also means that you need to understand your contractual data rights with those vendor agreements. Make sure they explicitly address the model training, data retention, and your rights to audit your data, right? And you want to make sure you're not getting data leakage and exposure on that sense of PHI, right? And so that's one. The other one is our architectural controls. The big buzzword for years has been zero trust, right? And how do you apply zero trust for your infrastructure, everything else? But your AI infrastructure is no different than your network infrastructure or your identity access management. You have to play that same concept into that across the board. And there's no implicit trust in making sure your gateways are logging, they're doing the identity-based access for your queries, and also metering, right? So a lot of these, companies that are out there today, for example, are using AI to help also reverse engineer certain capabilities, right? So if you have APIs exposed, hey, it's an approved data set. You want to make it easy for you to work with your vendors, partners, but AI can accelerate the consumption of those data and reverse engineer through some logic and data via the push and pull. Well, how do you control that? It looks like an active use case. Well, should you have some type of metering and threshold? So if you see high utilization, then that's something that somebody should be taking a look at and asking why and where and who, right? And that ties into the last one, which is really the continuous monitoring, right? treat those AI systems like any other production environment? How do you get ongoing visibility? How do you make sure you have line of sight into model drifts? And then how do you make sure that your vendors that you're bringing in to help you accelerate and reach AI capabilities, that they're being monitored and managed from a relationship and partnership? Last thing you want to do is find out that your models are going to train or hone their other clients and exposing you from a data rights and data audit and PHI compromise from a privacy and compliance perspective.
Okay, so I want to shift just a little bit to a few leadership questions.
Yeah.
So you've worked across multiple organizations. How do you think cybersecurity leadership needs to change as healthcare becomes more digitally connected?
Yeah, I think this is one of my big soapbox items because, the era, in my mind, the era of a security leader is just at a technical specialist with a compliance function is long gone, right? You can't do that in the world we're in today. Really what healthcare needs are technology executives and cyber executives who operate at the intersection of whatever their business and so business operations, clinical operations, et cetera, plus the acumen of understanding the business strategy, and then thinking about from a technology and security perspective, how they how and what they do that drives the business to achieve their goals and their missions with the right amount of risk to reward ratio, right? Too often, sometimes technologists and cybersecurity professionals will say it's either black or white. You either do it or you don't. Well, sometimes you got to figure out based off the risk profile and the value. When we talk about prioritization, there are trade-offs sometimes you have to do, right? Because you can't lock everything down, then the business can't function. You can't open it up
Right.
because then the business will be compromised. So you are that architect that's threading the needle between the business strategy for growth and operations day to day versus how do they make the most use of the resources, whether it's technology, data, systems, et cetera, to help achieve their mission and focus, right? So the best security leaders I've seen are generally embedded in the product and technology strategy space. So they know, they live it, they breathe it, and they're not consulted at the end, right? But because they're trusted partners, they're at the very beginning helping to shape the solutions and mitigation strategies to make it an effective either product launch or operational capability for that particular business. So,
Right. Okay. So one of the things that security leaders have to do when they become kind of these business partners as opposed to business advisors, as opposed to just operating in security, they have to communicate cyber risk in a way to business stakeholders in a way that makes sense to them. So what approaches have you found most effective for getting organizational buy-in around cybersecurity initiatives?
yeah. At the end of the day, because it's all well intentioned, right? There's a lot of issues, risk. Engineers and security engineers want to address those and try and make their environment as risk adverse as possible, right?
Mhm.
But sometimes what's lost in all of that, and to your point here, is how do you effectively communicate that for buy-in and support? Because you got to really translate those risks into a business language and anchor it on key decisions that are already being made or being faced. So, for example, business is looking to grow into a new market or a new product line, right? Well, what's the cost of not doing security for that? Ability, supportability, compliance, privacy, etc. Translating those type of things into the consideration so your product owners of that or your business service line leaders and GMs understand what those are will really help them sort of have a holistic solution. And you're part of the process. And it's not just you selling it, right? Because you're identifying the risk, but you're working with your business partners and matrix partners to figure out the right solution based off the cost, the value, and the risk acceptance, right? Another good lever, though, is in the world we're in today, cyber insurance is pretty foundational to protecting organizations,
Mhm.
right? Regardless of what entity you are in healthcare. But when your underwriter says your premium is going to increase 40% because of ABC control gaps, that's a good incentive and motivation
Right.
to also drive justification rationalization of some of those security roadmap things, right? But the other piece too is having some operational key metrics that demonstrate the value of those investments, right? So it's not just showing like, your CVE scores and threat taxonomies, but you're really showing like what the investments you're doing are actually helping drive, real world business outcomes and risk posture across your either interior organization or with your third party partners, right? So treating the cyber as no different than any other business function to do the business cases, the metrics and KPIs go a long way in building credibility, but also buy-in and support.
Absolutely. Okay. Final question as we wrap up. If you
Yeah.
were advising a mid-sized healthcare organization with limited resources today, where would you focus first to reduce risk in a meaningful way?
Yeah. The first thing I would always say is, do that first, what I call internal analysis or self-assessment, right? Look at
Like a risk
what you
assessment.
have. Yeah, the risk assessment, but also capabilities assessment. So
Okay.
from the sense of take a look at all the assets, services, software, license, hardware, where your dollars are going at the end of the day as an organization. And in particularly if you're leading that cyber function, what all the tools, software, services you have, right? Because most of these, not just get a good understanding of the landscape of what you have will help formulate for you what and how you can tackle some of these risks that you've identified. That also is paired up with me where you're going is the self-assessment. Do your internal self or risk assessment of the organization so you know where those uh, uh, big rocks are from a risk mitigation perspective, right? You need both of those things to help formulate your strategy and what you're going to do, right? Because sometimes you're paying for more duplicative services that you can use those dollars to help fund new gaps and close the gaps on solutions based off your risk assessment, right? So that would be the first thing I would say is do that first. Number two is start looking at your third party risk and your exposure, not just looking at it from a technology like who's your hypervisor, who are your third party vendors for integrations, data feeds, et cetera. But look at your vendors that are supporting your business, right? Because of the interconnected ecosystem we're in today, anybody on that supply chain of value for your
Mhm.
company is an injection point. The difference is you don't control that. You're reliant on your relationship with them and the controls and attestations that they've said to protect themselves, which then implicitly would or would not protect you. So understanding your third party risk, building those organizations around process controls and how do you build that relationship and monitoring management oversight with them is going to be key. And the last one is, I think all of us in healthcare know, it's not a matter of if you will have some type of cyber incident or event. It's
Mhm.
just a matter of when. So if you know something's going to happen to you, the one thing you should make sure you at least have documented is what is the incident response plan? So if something does happen, that's not the time to be trying to get on to ChatGPT and say, what's an incident response playbook and trying to figure it out. Because you need to have that documented, who you need to call, what are the controls to lock down the risks and exposure, who do you got to call from an insurance, or if you're a part of a parent organization, what's that communication pathway, right, for communicating out the risk, informing your leadership team, all those things, your legal counsel, all those things have to happen. And when you're in the heat of an incident, you don't have time to start thinking, hey, do I have to do A, B, C, D? You should have that as a very easy to read playbook, whether it's a visual workflow or a document, but something very easy to have on hand, socialize with everybody. So if something does happen, you know what to do and you're not scrambling, right? So those would be the three things I would recommend anybody do, regardless of your organization size.
Perfect. All right. All excellent advice. Thank you for joining us today, Mr. Spence, and have a good rest of your day.
Thank you, Sullivan. Appreciate it. Have a good time.
All right.
Bye.